On various hits, we are conducting various programs. As a part of that, today is the second session. It is being conducted by Mr. Santhakumar ji. Now I request the dignitaries to the diapason, please. I request Mr. Secretary, Mr. Mahesh Kumarul ji, Mr. President, Mr. Subhash ji, State General Secretary, Mr. Keshavan ji, guest speaker, Mr. Dr. B. Santhakumar ji, our beloved Honorable Justice Krishnan Ramsam ji, our President, Vice President Sudha Rani ji. Now I request our beloved President, Mr. Subhash Babu, to address the welcome speech.
Dear friends, we, the High Court unit of ABVS, is conducting a lecture series every month. Last month we conducted the same program, Injuries for Advocates. At that time the same Dr. Santhakumar gave a beautiful lecture. Everybody enjoyed. At that time we asked, we will complete 1 hour. He said it cannot be completed within 1 hour. It has to be continued for another 2 or 3 hours. That's why part 2 we have today conducting this program. For that we invite our Honorable Lordship Mr. Krishnan Ramasamy as a chief guest. Lordship is immediately accepted and visited here. I welcome Lordship and I welcome Dr. Krishna Kumar. I welcome Dr. Santhakumar. I welcome my friend Srinivasa Raghavan, Rajesh Saravanan, our State Secretary Kesavan, all our friends. Thank you very much.
Mr. Subhash Babu, President, and Mr. R.M. Mahesh Kumar, General Secretary of ABVS Varakarunjikal Sangam, and other office bearers, senior advocates, legal fraternity, ladies and gentlemen. Good evening to all of you. It's my pleasure to be here to inaugurate this program. Last week, the President and Secretary of the ABVS Varakarunjikal Sangam met me and requested to be a chief guest for this program. I immediately have accepted. And thereafter I asked them, so whether this is the first study circle meeting. They said it's not first study circle. It is a part 2 of the forensic science study circle meeting. But otherwise, they have been conducting the meeting for the past 6 months. But they also informed they along joining with the MBA is providing the hall. They have been conducting the program, this meeting. I really appreciate the effort taken by the ABVS Varakarunjikal Sangam for conducting these type of meetings. So even if you see that Madras, I don't think this type of meeting they have been conducting. There are many bar associations are there, and occasionally they used to conduct. But my endeavor is that if an association, because the lawyer association, they must have the study circle meeting periodically, not even for at least twice in a month. You must have schedule, yearly schedule or 6 month schedule. The updation of the law is required only for mainly for lawyers. Without updation, you can't do anything, even before the court, if you are appearing. If the other side is coming with the full updation, you have to say sorry face. If you see that Chartered Accountant Institute, Company Secretaries Institute, and other Cost Accountant Institute, they have been conducting periodical study circle meeting. They are updating the law. We are the lawyers. We are supposed to update the laws. So they are updating the law for their benefit and for their clients' benefit. If they are committing something error, it will be within that company alone. So ultimately they will come. We have to be an expert to handle those type of cases. whatever we are learning, that the advocate is learning, is not only for himself or herself, but also it is a matter for these institutions. It is not only for the matter for this institution, but it is a matter for the public at large. It is not only for matter for the public at large, but it is a matter for the entire nation. If you are committing any mistake, in the sense, in the same mistake is followed by the court, it will reflect in the judgment. So ultimately, it will be the law of land, and it will be unnecessarily a wrong law will be followed. And even if you are not, in the event if you are not updating, you will be not in a position to advise your client properly. So therefore, ultimately, it is a loss for the client. And due to the inability to advise, due to the lack of updations, and that your client is not in a position to carry on their activities. Ultimately, it's not only a loss for the that your client. It is an economical loss. The loss for ultimately this is a loss for the country as well. So therefore, the learning of your lawyer, updation of the lawyer, and the enrichment of the knowledge of your lawyer is not for himself or herself, but for the entire nation as well as the public at large. That you have to keep in mind. It is not other professions not like that. Suppose CA, if they are committing the mistake, it will affect the company alone. Ultimately, it will come to the court of law, then it can be rectified. But here, if you are committing due to the lack of knowledge, then it will affect at the nation as a whole. So therefore, you have to update your knowledge. You have to read and come before the court. I have come across many instances where the lawyers, due to the lack of updations, they are not in a position to convey their things properly, and before the opposite side, they have to say sorry face. Even one case that is regarding tax matter, that is my case is pertaining to the assessment year 24-25. The amendment has come. That 74A, section 74A was introduced. But adjudication was passed. They are supposed to pass for those years under 74A only. But the adjudication was passed under section 73-74. That will not apply. The lawyer is challenging that provision. Not by, on the basis of jurisdiction of not invoking the provision of 74A, but he says he is accepting everything. See, 19 crore liability. The turnover itself is 20 crore only. I asked, then after reading the paper, I asked myself, I asked him, he said turnover itself 20 crore, but you said how it is 19 crore liability. After opening the paper, I saw that it is an assessment year pertaining to 24-25. What is this you are supposed to raise? I said you are supposed to raise the jurisdiction. You have not raised it. What is whether you are doing justice for your client? But this is happened because of the failure on the part of himself to update the law. Even after the 2 years after the introduction of the said provision, he has not updated. That is the reason why he filed the writ petition with the wrong provision of law. So therefore, this is very, very important. Even for example, the budget has been announced. Budget meeting you have to discuss because it will use personally for each and every lawyer. Not only personally, but so many things are there. You can advise for your corporate client. Even individual also, you are supposed to be advisor to your client, not the chartered accountant or the company secretary. You are the lawyer. You know the nuances of the law. I am seeing that many chartered accountants appearing. They are not able to express. They are expert in the law. But even a 2-year lawyer, if he is coming, if this particular provision is, if I am asking him to interpret and file a case, he will do it very well. So therefore, there are a lot of opportunities there. Only thing is you have to update your laws from time to time. At least you can have the 2 meetings One is for regularly for conducting the meeting, regular meeting for other regular subjects. Other one is with regard to the amendment and new laws you can have. You can discuss one section you take regularly wherever it is litigation is coming. You can take that section. You can discuss. See here, if you are discussing about the topic, even if you will have a lot of benefit. You can clarify your doubt instantly from the speaker, either from the speaker or from the senior advocate or from friends sitting here. But even if you are reading in the papers at home, it is not possible. That's what I was telling about what is the benefit you are going to take, maximum benefit you are going to take from a speaker. But Mr. Santhakumar is an expert in the forensic science. See, because I don't know anything about that. But if he says something, I can able to intake. So he is going to, but for the purpose of delivering this speech, he is supposed to have spent some time. Maybe he is regularly delivering the speeches, they may not necessary, but still he has to update. So with full updation, with full expertise, he prepared a chart, he is going to deliver it for one hour. Just you have to intake. This 1 hour is, 1 hour if you are properly taking it, and it will be for lifelong it will be useful for you. This is the expert knowledge. In many ways it will be useful. Likewise, each and every meeting if you are attending, definitely this will be useful, and I'll appreciate the Adivakta is taking this effort, and I request the Adivakta to continue to take this effort and conduct the meeting, and every month, or at least every month, if possible twice in a month. That will be useful for all the members. But you maintain the timing schedule. If 1 hour means 1 hour. Don't go beyond that, because otherwise that you will not, people will not attend, because we are taking 5:30 to 6:30, if 7 o'clock if you are taking it, but other schedules will get affected. Suppose 1 hour means, okay, tentatively it's 1 hour, will sit and listen, will go. That will be successful always. Thank you very much for planning.
Thank you, Lordships. நமது நீதியரசர் அவர்களால் கொடுக்கப்பட்ட குறிப்புரைகளை கருத்தில் கொண்டு இனிவரும் நிகழ்வுகளில் செயல்படுத்தப்படும் என்பதை அகில பாரத வழக்கறிஞர் சங்கத்தின் சார்பாக தெரிவித்துக் கொள்கிறோம். இந்த மாலை வேளையில் தங்களது பொன்னான நேரத்தை எமது சங்கத்திற்காக வழங்கி குறிப்புகள் வழங்கிய நீதியரசர் அவர்களை கௌரவிக்க நமது உயர்நீதிமன்ற கிளை துணைத் தலைவர் ஆர்ஜே கார்த்திக் அவர்களையும் ஜாயின்ட் செக்ரட்டரி கேஆர் லக்ஷ்மன் அவர்களையும் அழைக்கிறேன். இன்று இரண்டாவது முறையாக நமது புத்திக்கு உணவு வழங்க நம்மிடையே வந்திருக்கும் நமது கெஸ்ட் ஸ்பீக்கர் அவர்களை கௌரவிக்க வைஸ் பிரசிடென்ட் மிஸ்டர் கோகுல்ஜி அவர்களையும் வைஸ் பிரசிடென்ட் மிஸ்டர் விஷ்ணுவர்தன் அவர்களையும் அழைக்கிறேன். நமது மாநில பொதுச் செயலாளர் கேசவஞ்சி அவர்களை கௌரவிக்க திரு மணிமாறன் அவர்களை அழைக்கிறேன்.
லார்ட்ஷிப் வந்து இன்வைட் பண்ண போகும்போது சொல்லியிருந்தாங்க இந்த பட்ஜெட் செஷன் இதெல்லாம் நீங்கள் பண்ணுங்க அப்படின்னு. லார்ட்ஷிப்போட ரெக்வஸ்ட் படி பட்ஜெட் செஷன் அரேஞ்ச் பண்ணிட்டோம். நெக்ஸ்ட் வீக் வெனஸ்டே வந்து சீனியர் அட்வொகேட்ஸோட ஒரு பட்ஜெட் செஷன், அது மாதிரி இந்த மந்த் வந்து அடிஷ்னலாக ஒரு 2 ஸ்டடி சர்க்கிள் நடத்துகிறதா டிசைட் பண்ணியிருக்கோம். தேங்க்யூ லார்ட்ஷிப். தேங்க்யூ வெரி மச்.
Good evening, mighty seniors. Let me go ahead with the topic first. Just to have a glimpse of introduction about the last class, I started with abrasion. To cause an abrasion, we need a hard object with rough surface. If it is soft object like this, there will not be any abrasion. But then if it is hard object, nobody would dare. But so it's such a simple scratch abrasion, but it will gain lot of importance. Can you focus on this? Lot of importance, because this will give us the idea about the scene of Crime. And there's such a simple scratch abrasion, when they are very closely arranged, they are called as graze abrasions. Grazing usually occurs in the road traffic accidents. When a person falls on the road surface, when there are small grits, when he is sliding on the surface of the road, the force with which he falls down will cause impact abrasions, and then the force with which he is swirling around will be causing the grazed abrasion. So by looking at the graze abrasion, we will be able to decide about the nature of the surface, the speed with which the individual had fallen, and the direction in which he had moved. Because in a scratch abrasion, the beginning point is called as the head of the abrasion, and the tail end of the abrasion will have the heaped up epithelium. So when such bunch of scratch abrasions are seen on the surface of the body, usually on a wider surface, that is called as graze abrasion. Then imprint abrasion we talked about. Imprint is the design of the weapon is imprinted on the surface of the skin in the form of abrasion. So I told in the last class that most of us would have played the game, keeping a coin on the skin surface and then pressing it for some time and removing it and looking at the imprint on it. If the same game is played with the rope on around the neck, that is a different game altogether. So that is going to result in imprint abrasion, but the patient will be out. Okay. The next is impact. When the person falls on the surface, in railway accident or fall from height, depending on the surface on which the individual falls, the impact will be either broader or smaller. Like in a student who had fallen down in Kallakurichi, the impact abrasion had really revealed a lot of things. Therefore, such abrasions are called impact abrasions. And then I try to explain what is a contusion. Contusion in Tamil they call it as a kandriya kayam. You hold the skin and subcutaneous tissue of a child and then give a pinch, there will be a discoloration after some time. Why is that? It is because the force is actually causing a rupture of the blood vessels under the skin surface, and the ruptured blood vessels will be exuding the blood, and that spreads on the surrounding tissues. Last time I tried to show or demonstrate how a contusion happens, but I was not very successful because the ice cube was very small, it was not visible for the first row. Now look at this picture. On the skin surface, there is no abrasion, but then the pressure has caused the rupture of the blood vessel and the blood has extravasated. It has come out of the blood vessel and penetrated, permeated, spread into the surrounding soft tissues. This is what we call as contusion. Generally, the contusion will be in the place where the pressure is applied, but sometimes the contusion may be at a site which is little away from the site of application of force. Sometimes there may be a force applied on the forehead, and after a few hours we can see the blackish discoloration around the eye, black eye. It is not that he had been hit on the eye, but then the injury on the forehead can cause the trickling down of the blood which has come out of the blood vessel and getting collected around the soft tissue here. Why? Because the pressure here is more, and surrounding the eyes, the soft tissues are having very less intertissue pressure. Therefore, there will be collection of blood like this surrounding the eyes, causing the black eye. So that we call as a remote contusion. தென்னை மரத்தில் தேள் கடிச்சான், பனை மரத்தில் நெறி கட்டிச்சான். Like that it is. Now look at this. This looks to be a simple graze abrasion, and in some areas we are able to see the denuding of the cuticle. The topmost layer of the cuticle has peeled off. We may think it is a simple injury, but then on dissection, we may see the underlying tissues are contused. You see the blood dissipated, penetrated into the soft tissues underlying the skin. And this will cause a discoloration after few hours, even after few days. For about 14 days, this discoloration will be there. Minimum of 14 days. Depending on the depth for which the blood has permeated, the duration will be varying. Now underneath, the force which had been sufficient enough to cause such a contusion had also resulted in the fracture of the underlying bone and the extravasation of blood from the fractured surface. So such collection of blood will cause the deformity as well as the swelling. So we should not just neglect it is only a contusion. If the individual has got about 50 to 60 contusions, the amount of blood which has extravasated in those areas would even cause death. If a person is losing the blood for about 1000 ml to 2000 ml to 2000 ml, definitely the person will go in for hypovolemic shock. So we should not think that contusion will never cause death. Yes, contusion will cause death, whether it is in Tirupponam or in some other place. The fractured bones, and the blood has extravasated all over. Definitely such contusions will be telling us a lot of stories about this. Therefore what we see overtly may not be the fact. Beautiful. But this picture appears as if this is the reverse of this picture. Is it so? Let us turn our head and see. It is not so. Therefore, whatever we look at, we must analyze. Therefore, simple contusion cannot cause death. No. Contusions can cause death. It can result in death depending on the duration of bleeding, depending on the blood vessel which has got involved, which has ruptured, and how many contusions are there, in which part of the body. If the contusion is there in the brain, that will definitely result in death. Therefore, we must be very careful to look at the contusions. Sometimes externally there may not be any injury, but then on dissection there will be a lot of bleeding underneath. Generally such things may really cause a lot of trouble for the doctor who is doing the postmortem, or for the advocates who has to interpret this, or for the judiciary to analyze whether this could have caused death or not. So the blood which is extravasated, which we are able to see in this picture, need not necessarily be confined to that area. It can go to the surrounding regions. It can cause pressure on the blood vessels in the neck. It can stop the blood going to the brain. It can get into the thoracic cavity, cause compression of the lungs, result in hemothorax and difficulty in breathing. The person may die. Externally there will not be any injury. As you see here, there is no injury at all on the skin surface, but still the person died due to this injury. Therefore, contusions are very simple to look at, but then when we go deeper, definitely it will reveal a lot of facts. Now, this skin did not have any abrasion, but then on reflection of the skin and subcutaneous tissue, we could see the contusion there. This happened in a police custody. So this is a simple contusion, but then further dissection would reveal the fracture of the ribs. Such fracture of the ribs will result in bleeding into the thoracic cavity, and slowly the collected blood will cause compression of the lungs. The person will not be able to breathe. So the police people will try to give some resuscitation and immediately take to the nearest private hospital, and they try to save the individual. But it will be very difficult, because once the bleeding has started accumulating, blood has started accumulating in the thoracic cavity, the compression of the lung will not be permitting him to expand the lungs. Therefore, he would die. No amount of resuscitation would help him, because that is going to be a tension hemothorax. Further and further tension will be increasing inside the thoracic cavity. Sometimes on the skin surface, in the scalp, we will not be able to see the contusion, because of the presence of hair. We will not be able to see the swelling. But on reflection of the scalp, we will see wide contusion like this. Such an extensive contusion will indicate two things. Number one, definitely there had been an injury at that particular site. Number two, the spread of the contusion will give us a clue about how long there had been circulation intact. How long the individual had survived, in other words. Only when the individual had been surviving for a longer time, the bleeding would have been there to the extent of spreading all over these areas. Therefore, when the contusion is in a very circumscribed area, the individual would have died within few hours. When the contusion is there all over the scalp, on reflection of the scalp, we will be able to see that. And such contusions will tell us that individual would have survived at least for 2 days. Depending on the duration of survival, the extent of the contusion may vary. Okay. Beyond that contusion, there are a lot of other things which are very minute, but then we will not look into that. Now next we go to the incised wounds. Considering the time, let me go to the incised wound. All these things you would have seen. In many movies, they show such incised wounds. The heroine will go near the tap, make a cut, and the window will be opened, and her elder brother's wife will be looking at, oh, enna karyam panne? Immediately they will try to come and save the girl, and they will be taken to the hospital, and the hero will be there hiding beneath the stretcher. This is a common scene. So these multiple incised wounds on the front of the forearm or wrist, we call it as hesitation cuts. Generally there will be multiple, and many of the wounds will be superficial, and one or two may be deeper, cutting the arteries, resulting in excessive bleeding and death. So these things will definitely indicate, unless and otherwise it is proved, they are all suicidal wounds. Suicidal incised wounds. So such incised wounds are caused by the force which is, see, the sharp edge of the weapon is approximate on the surface of the skin, and there is a dragging force. This is incised wound. So approximation of the cutting edge, and with the pressure there is a dragging force resulting in the incised wound. See, the process by which the incised wound is created will give us a lot of clues about whether the individual had been sleeping, or whether the individual had been resisting the injury, whether he was awake. All such things can be derived very clearly. Now this is a single incised wound. So to begin with, it is superficial, and it is deeper, the body of the incised wound. And then when the weapon is dragged out, taken out from the surface of the body, then it is further superficial. So all such things will be giving us a lot of information about what is the relationship between the weapon and the surface of the injured body area. And the next we go to the cut injuries. See, such cut injuries on the hand, we call it as defense wounds, which indicate that the individual had been alert and he was trying to prevent, block. Supposing this individual had been sleeping, could he have sustained such injuries? தூக்கத்திலேயே இப்படியே தடுக்க முடியுமா? Only Jackie Chan can do that. So such cut injuries will give us details about the amount of force, the nature of the weapon. Possible with this weapon. This injury could have been inflicted using this weapon, but if the weapon given by the police is this, that means he is trying to fool us. Generally, the police people will do that to fool others. ஏட்டையா வரும்போது அப்படியே ஒரு கத்தி வாங்கிட்டு வா. He will go, the shopkeeper will tell, ஐயா இது 150 ரூபாங்க ஐயா, அது கம்மியாக தர மாட்டேங்க ஐயா. யா சும்மா கொடு, இந்த 30 ரூபா. So he will try to take that 120 rupees and then use only 30 rupees to buy this. And then he would expect us to believe that this injury had been inflicted by this weapon. Impossible. Therefore, while analyzing the postmortem certificate, we must be able to apply our mind. What is the dimension of the injury? What is the nature of the weapon? What is the weight of the weapon? What is the cutting surface? All such things we must be including in our analysis. Sometimes the cut injuries may be multiple and superficial. That means the individual had been alert, active and preventing to block the injuries, and the weapon was not of this nature. It would have been slightly lighter in weight. Then only such injuries, it may be a kitchen knife. Supposing the individual had used this weapon, this finger, index finger, would have fallen off. Therefore, the nature of the weapon should be compared. Multiple cut wounds. Now look at this. Whether it is an incised wound or cut wound, the same injury, the same neck. From which side to which side? What are the subcutaneous organs involved in this injury? Whether the injury had been inflicted from this side or this side, all such things will be there in the questions when we analyze the crime. This particular injury had been created by the person who is sitting in an auto with the victim sitting in the center, and on either side there were the assailants. Now the question was, who had inflicted the injury, whether the person sitting on the left side or the right side of the victim? So we have to be very careful and very slow in analyzing the nature of the injuries. So this side it appears to be superficial, it appears to be deeper, which can be revealed through the postmortem certificate. Now here the trachea is cut. Yes, cause of death is very clear. Now who had cut? Whether supposing a person who had been sitting on this side is A and this side is B, whether A had inflicted this injury or B had inflicted this injury. Of course, the weapon may be a sharp-edged, light-cutting weapon. Depending on whether the A was a right-handed individual or a B was a left-handed individual, it will vary. Because a left-handed individual would start the injury on the comfortable side, and the right-handed individual would start on the left side of the victim's neck. We can easily analyze when we have the knife, when we are right-handed, the amount of injury which we are inflicting with the left hand will be lesser compared to the injury inflicted with the right hand. Therefore, when we confront a case like this, we must be able to analyze whether the A or B is left-handed or right-handed, because there is a case like this in one of our advocates' son's death, we are really still suffering to analyze. because of the non-acceptance of the facts. What do you see in this picture? A girl or a Kalavi? I'm sure some of you would be looking at an young girl, eyelash, nose, and other thing. But some of you would be able to see the nose, the mouth of an old lady. It depends on how we look at it, from which angle, and depends on the interpretation of what we see. Therefore, whenever we look at the injuries, we must be able to understand that whether this is possible or the other way it is possible. There is an injury here on the head of the individual. It starts from here and it ends here. It extends from this point to this point. Whether such injury would have been possible using this weapon or this weapon or this weapon. Consider that this is heavy, which is possible. Now think over. Now look at the dimension or the length of the injury from here to here. It is extending on the curved surface of the head also. Supposing the weapon had been straight line, like this, or even like this portion, would this injury be possible? No. The weapon necessarily should have been a curved weapon. Therefore, the cutting edge of the weapon comes into contact with a longer area. If it is a straight cutting weapon, the point of contact will be only few centimeters, maybe about 2 or 2.5 centimeters, not more than that. And if the curvature is very less, again the point of contact will be only 1 to 2 centimeters. Therefore, the length of the injury on the surface of the skull will give us a very nice clue about the nature of the weapon. So we must be able to compare the nature of the weapon and the nature of the injury, or the length of the injury, and also the depth of the injury. The depth of the injury is very less. That means the weight of the weapon would be very less, and the force with which the blow had been given would be less. So all such things should be considered while analyzing the injuries. Next we go to the stab wounds. Many times this stab wound will cause a lot of confusion. Looking at this, we can say yes, stab wound, stab wound, stab wound. This doesn't look like a stab wound. But still, when we are analyzing very carefully, spindle shaped, but here on one end it is acute, narrow, and the other end is blunt, narrow or acute. So that means it is a stab wound inflicted using a single-edged weapon. The sharp end would create sharp end, blunt end. The blunt end would cause a broad surface, margin, whereas the sharp end would cause a very narrow, acute margin. So depending on the nature of the ends of the wound, here it is acute, it is blunt, acute, blunt. That means it is not a double-edged weapon. And if it is a double-edged weapon, both the ends will be of the same nature, acute. So it is caused by a single-edged weapon. And the blunt edge would be having a broad surface. It may be blunt, but then the surface should be broad enough to inflict such end. Acute end, blunt end. But if you look at very carefully, in the blunt end, there is a protrusion on the sides, both the sides. That means it is a rimmed, non-cutting blunt end. There will be some raised edges on the non-cutting edge. So those edges would have inflicted an injury with a sharp end on one side, blunt end on the other side, and the blunt end would be causing some protrusions on the sides. Now, when we are reading the stab wound descriptions, we must be able to analyze whether the injury had been measured properly or not. The length should be measured with the margins approximated. Otherwise, what happens? There will be widening of the wound margins. Because of the lines of Langerhans in the subcutaneous plane, the wound will dehisce. There will be widening. No knife is going to be 2 centimeter width thickness. But when the injury description is that the length of the wound is 5 centimeters and the width of the wound is 1 centimeter, can we imagine that the thickness of the knife is 1 centimeter? No. No knife will be 1 centimeter thick. But what we have to necessarily do is bring this margin to this margin, approximated to each other, then measure the length. Then the width also will be reducing. Keep the hand on both the sides, away from the wound margins, and then approximate. And then measure the length and width. So such things must be done by the doctor who is doing the postmortem. But no such things are done. Generally, you would have never seen such description in the postmortem certificate. And we will never be able to find out because we do not have such sufficient knowledge to analyze such things. Therefore, all these things should be. So now look at this. This picture is very good to look at. This margin and this margin should be approximated so that the length will vary when we are approximating that. So that will be reflecting the width of the weapon. The length of the injury is equivalent to the width of the weapon. Therefore, whatever weapon has been produced by the head constable, we will be able to analyze whether he has got the correct weapon or not. Many times I would have seen that so inspector will tell, head constable will come and display all the weapons. Sir, the weapon path solung sir. So I will go through the postmortem certificate. So width 3 centimeters. This is correct. Sir, I am telling the fact. It may be very unpleasant to hear, but that is the fact. Most of the forensic experts would really agree with me. Therefore, the width of the weapon will be equivalent to the length of the thing. Now the question comes, supposing a person has stabbed and dragged, the length of the wound would vary, but when he is dragging like that, the subcutaneous tissue which had been cut through would vary. That is why in explaining the stab injury, you have to know what is the direction of the wound, whether it is pointing upwards or downwards, forwards or backwards, inwards or outwards. All such things should be analyzed. Why is it unnecessarily he has explained all these things? There is a stab injury on the chest. Enough. He has died. That is not sufficient. We have to analyze thoroughly so that we will be able to understand the nature of the weapon and the force and the comparative position of the assailant and the victim. Okay, this already. No, this we have seen already. Okay. No, this was a person who was stabbed in the mall. Only one stab injury and the individual had died. Now look at the place. This is the umbilicus. This is the left side of the upper part of the abdomen. And it's a single-edged weapon. Well, now it's very easy for you to tell. Now looking at the picture, you would reverberate in your mind whether it is a single-edged or double-edged. So it is a blunt end and this is a sharp cutting edge of the weapon. Now what is the direction of the wound? On dissection, we found that the direction is this way, front to back and from inward to outer. On that part of the body, we have the spleen. Once the spleen is injured, there will be excessive bleeding, and on opening the abdomen, we could find about 2.5 liters of blood. Single injury. Therefore, a single stab injury can kill within few minutes. Not like in movies, where with multiple stab wounds and firearm injuries and all that, still the hero will be able to fight this and then kill 20 people. Particularly in Telugu movies, you see. But we will not be able to digest that. Therefore, the nature of the wound are externally, and on dissection, what is the direction and what is the nature of the, supposing the track of the wound is gradually narrowing and going to the pointed end. That means the nature of the weapon is sharp-tipped. Sometimes the stab injury can be created by a screwdriver also. The tract appearance would vary. Therefore, stab injury should be analyzed very carefully. Next we go to the laceration. Laceration, in many places they call it as kilinda kayam. In many places they call it as sidainda kayam. Kilinda means only when it is a paper it can be torn. Now I cannot tear this, but I can lacerate this. How it can be lacerated? Using a small hard object and hitting forcefully. Yes, we can lacerate. And with little force also, with a heavy weapon, can be lacerated. Heavy weapon, little less force, it can be lacerated. Light weapon, but we have to use heavy force, then only it will be lacerated. Therefore, the lacerations will give us a lot of idea about how this injury had been inflicted. Now these lacerations will not only cause disruption of the skin surface, it will cause excessive bleeding underneath, and it can cause fracture of the underlying bone. The individual may or may not die instantaneously. It depends on the number of fractures, number of lacerations, depending on the quantity of blood which has got extravasated, whether the individual had gone in for hypovolemic shock or not. Now look at this. Multiple lacerations, abrasions. So such things will give us an idea about whether the injury had been inflicted when the individual had been alive or after death. Because such aberrations can happen only when the individual had been alive. If a dead body had been abraded using a rough surfaced hard object, then in such a situation the discoloration will not be reddish brown. As the time passes on, the reddish brown discoloration will become brown, and if he still survives and he has got only abrasion, as most of us would have experienced, after 2-3 days it will become hard, which we call it as a scab, and after a week's time the surrounding region will become whitish or glistening. We call it a silver lining of the abrasion. Then after 7 days, slowly the marginal surface of the scab would raise from the surface, and many times our hands will not be keeping quiet. We will try to slowly lift and break it. Sometimes when we use little more force, there will be further bleeding. And sometimes the threads of our clothing will get caught and we will get further injuries. So such injuries will be giving us a lot of clue about whether the individual had sustained the injuries whether when he was alive. Multiple cut injuries. How can one explain this? Very difficult. Unless otherwise we explain that as a multiple crisscross overlapping cut injuries on the lower part of the nape of the neck, on the left side of the face beneath the earlobe, and on the upper part of the left shoulder, numbering 17 and of varying depth from 0.5 to 2.5 centimeter. We will not be able to explain this. But however much you explain, however good you are in English, you cannot explain that to the court properly. The judge will not be able to understand. But one photograph will give us very clear picture about the nature of the weapon, how badly the individual would have been pressed to cut and determined to cause death of that individual. So all such things will be reflecting not only the nature of the weapon but also the mens rea. Now sometimes we get the injuries and the police people rarely bring the weapon also with which such laceration had been caused. Now this was one such case where I could see the laceration on the right side of the head. So he had brought one big stone. I said rarely they bring the true weapon. Could see the margin of the weapon with the blood stain properly getting mashed with like a zigzag puzzle along the margin of the wound. Now one such photograph would reveal so many things to the judge. Yes, this is the actual weapon. The police had not implanted any weapon, and we have to really do the clean shave work. Once we do the clean shaving, we will be able to understand what is the underlying injury, the fracture underneath, which we call it as a signature fracture. The weapon puts its signature in the form of fracture. The surface of the weapon is imprinted in the form of fracture, so we call it a signature fracture. There are other types of fracture which we will see. Okay, another is the laceration, which is a complete crush laceration. This is very common in road traffic accidents, railway accidents, fall from height, blasting of the head. We cannot say that a bicycle had run over him. No, people write stories, they are very good. Can this be due to fall from height? The individual had fallen straight like this, the head down, and there was a stone. No, all such things cannot be. Because there will be some injuries which are surrounding such major injury. There will be, along with the major injury, there are some abrasions and contusions must be there. So we must analyze very carefully. Complete splitting of the head. This happens in the railway accidents very commonly. This boy had been actually hanging from the train, and there was an electric post. His head had hit on the electric post. So we could not find any other injuries on the body, and the fellow had fallen dead. So such crush injuries in road traffic accidents will reveal the vehicle. whether it's a heavy vehicle or a scooter or Maruti car, I-20. Many times they change the vehicle. Therefore, we must be able to analyze the injuries and other things. Crush injury, total run over on the body, chest and abdomen, the liver, every organ is in, the lungs are here in the abdominal cavity. Total crushing. That means a heavy vehicle had run over his body fully. It's not from fall from height, cannot be. Run over. In such cases, we must look for the imprint aberrations. The lung had come out through the axilla. So much of force had been there. Now, avulsive lacerations. Now, you see, no injury there on the thigh. But still, the scrotum, the testicle had come out. The scrotum had been crushed. So, such compression of the thighs would result in avulsion. February, mochakota, ஊற வைக்கிறோம், பிதுக்குறோம். We don't cause any aberration on this mochakota surface, but then we just press and it comes out. Such things are there. When we don't have any injury, we should always look for the injuries on the outer surface in the form of imprint aberrations. Then dismembering lacerations. Sometimes the individual may lie down on the railway track and the wheel will run over and then completely disrupt the body surface totally. Sometimes the person will die down with the neck on the railway line. So the head will fly off. We had a case where the body was brought by railway police and the head was brought by the local police about 2 kilometers away from the scene of crime, where from the body was recovered. Because of the speed of the running train, the head will be just flying off from the scene of occurrence and it will fly and go and fall after about a distance of about 1 kilometer also. Because it depends on the speed. No, we can understand what is the train, with what speed it had come. Also then we can analyze. Now, how do we say whether the individual had laid on the track or it was the dead body which was laid on the track? In many situations, we come across such thing. The individual may commit suicide, but for the sake of claiming insurance, they may say that the individual had been run over by the train. Now look at the margins of the wound very carefully. If you have an abrasion here, there, that means the individual had been alive at the time of lying on the track. If the dead body had been laid on the track, there will not be any contusion, there will not be any abrasion on the margins. So these marginal abrasions will always give a clear picture about whether it is an antemortem or postmortem. And how do we say that this is the head of this body? How do we compare? Immediately everybody will say DNA, sir. Thanks to Bill Clinton. He has made DNA very popular. But before that, even without any such thing, we can examine the cut surface. Which bone, the neck bone, cervical vertebra, which bone is fractured here in pieces and which bone is here, and collect that and then play the zigzag puzzle, match the margins and see whether the cut portion of the cervical vertebra is matching with the cut portion on this part of the body, head and the body. Therefore, we will be able to say whether this is the head of this body. Sometimes externally we will not have any injury. The individual would have fallen with a thud and he would have died within few minutes. What is the reason? So there may be laceration of the liver which is inside. Externally there may not be any injury at all. But still the pressure would result in laceration of the liver. And once the liver is lacerated, and that will result in continuous bleeding into the abdominal cavity and the individual may die. This happens particularly when the spleen is lacerated. Because spleen laceration can happen even by forceful the spleen will lacerate. Particularly when a person had been suffering from recurrent malaria, the spleen will be enlarged. Normally it will be 6 centimeter into 3 centimeter into 1.5 to 2 centimeter. That is the dimension of the spleen which is there in the left side of the abdominal cavity. But then when the person is repeatedly getting malaria, like the persons in North Madras, even forceful sneezing will result in rupture of the spleen, and that can cause death. Nobody would have touched him. He would have been lying in the cot. That morning he would have been dead. Periodical. Generally we attribute that to ghost. He would have sneezed 2-3 times and the bleeding would have caused the death. So even trivial injury, that's why I teach police people, never hit on the left side of the abdomen. They want to avoid any external injury, hit him. I tell them not to hit on the left side of the abdomen because the spleen will rupture. Right side, that requires little more force. But spleen will rupture, even with little force it will rupture. Sometimes the force which is sufficient on the right side of the abdomen may cause internal laceration of the liver, like the liver is of this shape, and the force may cause even complete rupture of the laceration of the liver. Now, just to brush your brain. Now look at this injury. This is the chin and this is shoulders and this is the neck and there is an injury here. Definitely it is not an abrasion or contusion. It's a laceration. Fine. Everybody would tell that. But what would have been the weapon? That is the question. Sir? Acid. Acid. One answer. Any idea? No, no markings. You can feel free. Come on, imagine. Todapakata? Not possible. Like that you imagine. Any weapon. Broken bottle. A beer bottle which was broken and hit on the neck. So multiple depths, multiple stab wounds surrounding the main injury, and we got varying depth of lacerations or stab wounds that had resulted in such injury. Therefore, it's not that simply we describe this is a laceration, this is the weapon. No. Sometimes such tricky situations may arise. So we must be very careful. Therefore, the photograph is important. If the doctor had enclosed a photograph of this injury, the judiciary will be able to understand this very, very clean, without any doubt in their mind. This looks like a cut injury, a deep cut injury. But whether it is a post-mortem injury or ante-mortem injury, multiple cut injuries on the body, but looking at this we said now it is not ante-mortem, it is post-mortem. Why? Because there is no contusion here, there is no abrasion here along the margins. Therefore their dead body would have been cut. Multiple parts of the body, hands, feet, legs, trunk portion. This had been lying in the well for about 2 months. We went there and then fished out the body. Now how do we decide? How do we go about? And we have to find out who the deceased is. What is the age, gender, and when did that individual die? What is the cause of death? So we have to very, very patiently look for any identification marks on the body, any mole, any scar on the bone. All such things should be very carefully examined to say with firmness whether this is the dead body of so and so. So this was one such case where we had a big challenge, and then we were very meticulously examining, and then we found out the disease was a female and her husband had killed her and then put the dead body into the well and then closed it. So after 3 months, as he said, she had not come back from Kerala. So we said, oh, there's something wrong. So we went there. Now we go to the head injuries. Now before that, another. Now look at this injury. It is a cut injury. Now we know what sort of weapon would have been used to cause this cut injury. Now the question is whether it is ante-mortem or post-mortem. There is no aberration or anything. It is on the scalp and the subcutaneous bone. Now the scalp, the hair had fallen off. Rather we have reflected that. Though the margins should be examined thoroughly. The margin of the wound, whether there is contusion. If you have a doubt, take a small bit of the skin and submit it for microscopic examination. We have the facility in the medical college. Even in the primary health center where they do the postmortem, they can send a bit to the pathology department in the nearest medical college, because now each and every district has got a medical college. So to confirm that whether it is an ante-mortem injury, we have to use the microscope. Very rarely such things are undertaken by the medical officers who are doing the postmortem, but then it is a must. Now we go to the head injuries. Now look at this fracture. Now before that, now let me just finish that. This was a dead body, came in a trunk box from Delhi, brought by Ravliya police. Now how do we find out whether this dead body had been loaded at Delhi or en route? How do we identify this dead body? So we have to look for the identification marks. So one such important identification mark would be the tattoo marks. Tattoo mark on the right forearm had really helped us to pinpoint, yes, she is from this particular district. So likewise, even in the dismembered body, the body can be really identified. Okay, next we go to the head injuries. I told about the fracture, started about the fracture, and once the skull is opened, we should see the internal bleeding, intracranial bleeding. The skull can sustain aberration if he is not having much hair like me. Abraded surface can be there on the scalp, and it can be contused, it can be lacerated, and then underlying bone can be fractured. So we will see the types of fracture. Before that, now I have shown you the picture of the brain covered with a membrane, which is called as a dura mater. Dura mater. This is the outermost layer covering the brain surface. When there is a blood collected between the dura mater and the skull cap, vegetarians, please forgive me. I use the cabbage instead of brain because I cannot bring the brain here. Cauliflower, sorry. The non-vegetarians do not even recognize what vegetable it is. Once the skull cap is opened, we will see the brain covered with a membrane called as dura mater, and it has got 3 membranes. Next one is the arachnoid matter. Dura mater will be very loose, arachnoid will be slightly tight, and beneath that we have a very tightly packing the brain, we have a very tight, very closely adherent to that. That's called the pia mater. Now, depending on the collection of blood between the bone and the dura mater, or dura mater and the arachnoid mater, arachnoid membrane, or between the arachnoid membrane and the pia mater or pia membrane, the name of the bleeding or hemorrhage would vary. When it is outside the dura mater, beneath the skull cap, it's called extradural hematoma, which generally we will find it very confusing. Extradural, outside the dura mater. And when it is beneath the dura mater, it's called subdural. It is the dura mater. The blood which has been on it had been washed away, and when we remove this dura mater, we will see the blood. When we totally remove the dura mater, we can see the collection of blood. This is the dura mater or dura membrane. So this is a clot. Here again I will tell you something. The amount of blood will indicate the duration of survival. If it is in the clotted form, it has taken so much of time for the collection of blood, oozing of blood, and the blood got collected. And if it is not a clot, it is so much of fluid blood, that means within few minutes after sustaining the injury, the individual would have been dead. So it's called a subdural hematoma. When it is in the solid form, it's called a hematoma. When it is in the diffuse or liquid form, it's called as hemorrhage. Subdural hematoma. So we wash that, we remove the subdural hematoma, and then still if the blood is there, we call it as subarachnoid. That means after removing the dura, the blood was there, we have removed it, and still the blood is there, it's called subarachnoid hemorrhage. Now we have washed it, still the blood is there, subarachnoid. And when it is into the brain tissue, we call it as intracerebral, into the tissue of the brain, intracerebral. Depending on which part of the brain the bleeding is, we call it as thalamic, frontal, like that, depending on the area of the brain. All that doesn't make much difference in the law, but then we must know the importance of this intracranial bleeding to assess the duration of survival. How long the individual would have been alive in the hospital, or he could have been dead in the scene of crime itself. All such things we can understand by going through the postmortem certificate. Now let's go to the fractures. Generally people talk that நான் என்ன செய்யறது என் தலையெழுத்து. So people who are interested in seeing the தலையெழுத்து can see this if they are not afraid. See, there is nothing. Brahma has not written anything on our head, though we talk like that. It is the writing is only the bones which are articulating and then finally getting fused. That line looks like writing. That's what we call as Brahma எழுதியிருக்கான் நம்ம தலையில. But as the age advances, they start fusing. After 40 years. Now, at about 70 or 80 years, it have completely fused, it would have become a single bone. It will be like this. It will fuse. And this is the frontal bone, and this is the parietal bone, and at the junction there will be a fontanelle, and that will be a gap. And when the children become little feverish, put the hand here, you will feel the temperature. And only when the temperature falls down completely, the temperature in this region will come down. That is why in childhood, nobody will be permitted to hit on the head particularly in Madurai. ಮಂಡೆಯಲ್ಲಿ ಮಾತ್ರ ಕೈ ಬೇಕದಿಲ್ಲ ಮಂಡೆ ಅವನೇ ಬರ. In other districts, they don't know this science. So they permit. So this is Brahmanoda Talayeluthe. Now, when there is a fracture along the line of union, that's called a diastatic fracture. It is on the surface of the bone. That's called fissured fracture. So what we see here in this picture is the fissured fracture. தேங்காய் உடைக்கும் போது முழுசாக உடையலைன்னா ஒரு பிளவு பட்டிருக்கோம்ல, that's called a fissured fracture. This is a diastatic fracture along the line of fusion. Diastatic fracture. Why should the lawyer know about this? This will indicate the age of the individual. This will indicate the direction of the force. This will indicate the amount of force. We can definitely analyze all these things. This is a fissured fracture coupled with a diastatic fracture along the fracture line. Now here we are seeing the fusion line, but still the fracture is there running along in so many places. So what is such fracture called, and how does this happen? See the fracture lines. This is a comminuted fracture without displacement. That means the individual had sustained an injury on this portion of the head, but the force was not enough to cause displacement of the fractured fragments. So he would have been pushed onto a wall, or he would have fallen down. So such things can cause a fracture of this nature. Still the fractured bone is there in the intact position. Now here the same comminuted fracture with displacement. They have dipped into the brain, they have been displaced. That means the height from which he had fallen down would be more. What will happen if the person is hit with a rod like this? The dimensions of the rod will be causing a fracture in the form of depression. This is called as a depressed fracture, and the dimensions of the fracture will reflect the dimensions of the point of contact of the weapon. Whether he had been hit with this weapon or this weapon, we can easily differentiate. Comminuted fracture with total displacement. Complete displacement, this we call it as a blasted fracture, blasting fracture. Blasted. Falling down from the running train, or fall from second floor or third floor, like yesterday in Maharashtra, 3 students had fallen down. Their skulls were fractured like this. Head on. So blasting fracture. And next is the hinge fracture. Hinge fracture is when the person falls down and he is landing on his feet. The pressure is actually directed upwards. It can cause hinge fracture. The base of the skull will fracture and it will be like a hinge. So this will very clearly say that it is a case of fall from height. Surgical fractures. Multiple burr holes, and the burr holes are joined using a Kushner wire, and this flap is removed and the blood which has been clotted would be sucked out and the flap would be replaced, So these are all surgical fractures. Craniotomy fracture. And only one burr hole, they have removed the bone piece, craniectomy fracture. I wanted to give some message. When you are eating particularly too much of oily food or non-vegetarian food, be careful that your blood vessels may get clogged, blocked. நெய் தோசை சாப்பிட்டாலும் சரி, சிக்கன் 65 சாப்பிட்டாலும் சரி, ரொம்ப சாப்பிட்டா you may have this problem. And the heart vessels are the easy targets. Therefore, whenever you are eating ghee roast or chicken 65 or mutton chukka, be watchful of your heart. Look at that boy, how happy he is. Yesterday I could see my friend in the court getting tensed up. Sir, இன்னும் வரலையா சார், சொல்லுங்க சார், சார் எங்கள் சீனியர் கேட்பார், சார் வர சொல்லுங்க சார், வர சொல்லுங்க சார். My senior got caught in another court. He was rushing. This young advocate was really getting tensed up. I called and said, don't get tensed up. You won't be able to live your life. Your circumstances will decide your life. Don't do that. Be calm and quiet. Many times the advocates irritate people sitting on the top. Many justices, cool cats. Morning to evening, they keep their face very smilingly, listen to all nonsense. They are sitting alone. Please imagine how difficult it is. Nobody to talk. You can't do anything. You can't even yawn. It's a torture for the justices. I always feel that. But still they smile. I don't know. I don't know how they are. Huh? Look at this guy, how happily he is sleeping. Huh? Surrounded by so much of filth. Yes. One of the photographs which got me the best photographer award in India. Thank you very much. And I still have a lot of things. I have just shown you the tip of the iceberg, and definitely I look forward to really impart as much as possible to the advocates community so that they will be able to have some meaningful cross-examination in the trial courts. So thank you very much. The thread will continue. Thank you.